Thank you, Grace. Can you send us the pictures later? Can you send us the pictures later?
Yes, I will.
Can you make sure I look half my size?
Yes, yes. They're gonna blow you
Color my
away.
hair a little bit.
You can hire me
Okay.
after you're mates. You guys see it?
Okay. We're good to go? Can you hear us? Great. Hi, everyone. Um, this is Sindhu Adini from Spring and Bobby from DocBox. Um, we are here at the HIMSS conference in Vegas, HIMSS 2021, and we are here to talk to Bobby about DocBox, where we see DocBox is going, and how remote patient monitoring has been really been the focus or the topic of discussion in these near times. To give a quick intro, Spring ML is a Google Cloud partner, a Twilio partner, and a Salesforce partner. And we are focused on healthcare and life sciences solutions. You can see us or you can know more about us at www.springml.com. Over to you, Bob. Bobby, why don't you tell us a little about DocBox, how it got started, the vision, and where you see it heading?
Thank you. Thank you for the opportunity to be here. Appreciate it. DocBox started in 2007. Very from a final engineer, years over guys at Mass General, to really look at what is connectivity, what does data architecture need to look like. That with government bodies, with standards, they came together what architecture needs to be. Fast forward to 2016, a product came about. We deployed clinicians assisted in critical care in 2016. Started first in India, Atlanta Hospital. Customer also being involved and now rolling over to America. That's our debut hit. So we're a neutral MIOT platform. We connect all the medical devices around the bedside. We collect 2 to 3 gigabytes of patient data per day, and we digitalize those documentations. So the beauty of it is nursing documentation, we actually automated by 70% today. And we talk about being vendors, which is extremely important. Prior to this pandemic that we've been going forward, a lot of connectivity, data capture has been about keeping it on-prem. Now, since January 15, we've been asked to, okay, we want to take critical care outside the hospital walls. How do we do that? And that's really what we're coming to play. We work with third-party companies. Third parties are able to put their apps onto our platform, which is what we're able to do. We work with a company called VitalNet and Review that sits in lab with others as well. So where are we going? For the first time in my life that I've been in healthcare, I've seen US, Europe, and the developing world lack of skilled physicians, lack of beds, and more patients that need critical care. So this is where we're able to go down with patient-centric. We can scale down from single bed. We can scale up to a huge hospital that's in multiple countries, which is what we're working on. So it really does allow that connectivity. And as you know now, you want sophisticated telehealth, you now need somewhere in the cloud infrastructure. Hence our partnership with you, and we're really excited in terms of what we can do. So that's been fantastic. So that's what brings us here today.
Thank you. Can you briefly talk about Nixon as a project and the impact?
Yeah. So NETS, National Emergency Telephone Network that came out, really looking at doing virtual ICUs in hospitals, which is rapid. So whether you're setting up any disaster zone, what do you need to do? You need to set some ventilator, monitor the bleeding out, and also have that connectivity via the cloud. We're able to get that skilled physician, that intensivist, even in the nurse, to provide that care immediately. You're able to do it. So you're taking it in any zone that doesn't have the infrastructure we have today, taking it outwards to any location that have that care. And that's what we're doing today. And that's it. We use the cloud, which Google, as you know, been that great advocate for us, and also having that framework, which is what we need as well.
Right.
Yeah.
Okay. So thank you, Robin.
No, my pleasure.
And then we definitely want to give opportunity for Tracy to talk a little bit about the vision of the platform, what it really does, a little more in depth.
Yeah.
So Tracy couldn't make it here, but she's on the show and she's gonna talk a little more about the DocBox platform.
Hey everyone, I'm Tracy Roush, the Chief Innovation Officer of DocBox. And today, you've heard a little bit about DocBox from Bobby, but the challenge, but I wanted to talk to you about a specific project that DocBox has been working on over the last 18 months with Google and Spring ML around the National Emergency Telecritical Care Network, and how does that impact us and beyond emergency medicine, but into your normal critical care medicine as it goes forward. So the challenge that we were put in front of us for this nested project is how do you provide critical care anytime and anywhere? And this could include outside the walls of the hospital. What happens if we have to set up a convention center to take care of hundreds of patients? What happens if we have to, move into a nursing home and actually provide critical care on site, or actually even into your home? And so this project was started with that, and there's three things that was really the insights. They wanted to provide the traditional telemedicine services into critical care, audio, video, messaging, come into the market over the last 18 months. So remote doctors could assist local doctors in providing critical care. But the next piece of this puzzle and the next levels that have been put forward as a challenge is how do you turn this into clinically usable information? How do you automate the collection of data? How are you non-human dependent? How do you actually provide this care with potentially even not a human being in the room? And then how can you turn this data, in parallel to this, in conjunction is, how can you turn data into operational insights for analytics and metrics for the hospital? One of the things that occurred during COVID was how many ventilators were in use, how many were available, what happens if that data can be collected automatically? What happens if you can see what your utilization of your beds was automatically? You didn't have to query a system, you can see it in real time. What happens if even that, not only that in detail, you could actually see the information that you would have provided for your, what ventilators for the patients on, so you could actually predict when they're going to be discharged as you move out, and you can start to model when you're going to have more ventilators available, so you can deal with staffing as well as intaking of additional patients. All of this was provided as part of this problem, and our current solution was the foundation and base for this. So the clinician's assistant to clinical integrates the bedside medical devices and allows for nurses and clinical observations and documentation to occur directly at the bedside. This data is normalized and we're made into standard nomenclature, standard data format. This data can be then sent to the electronic medical record, as well as we can retrieve medical record data directly at the bedside. This provides this easy, user-friendly UI for the nursing staff and the physicians to be able to see all of this data directly at their fingertips right next to the patient. The other thing that this does, and the platform itself does, is allow for other applications to be in this platform. These other applications are where you would bring in your AI and your machine learning and your insight. There has to be an infrastructure in place to deploy these. Not every application developed can't have its infrastructure in place. It's not cost effective. It's not actually physically feasible to have every single one of these applications running on their own infrastructure. What happens if they could all operate on a shared return on investment? With the DocBox Clinician Assistant, we have a lot of different insights that come into this. We've been able to prove that we can recover additional revenue through the automation of data collection and that patients' bills. We are able to solve the integration challenge that's faced with a lot of electronic health record systems across the country when you start to integrate medical device data, including the mapping of terminology. Every time you buy a new device, you need to be able to have to redo that mapping. How do you normalize vocabulary or multiple devices? This is all done for you in the clinician's assistant. You can use this data then for clinical care. You see trends directly at the bedside. You can ask your own questions and insights at the bedside. And the other thing that we were able to see, because of our user-friendly user interface, we were able to reduce documentation time by 70%. you know, and automating that collection and making it easy and trustable for the data to be inside. And this was actually done through not only automation of medical device data into that nursing flow sheet, but the simplification of a lot of the nursing observations and through single button pushes. So if you imagine, if you could just walk up and say, "Oh, this is this is the patient sedation score." This there's no writing; it's easier to do. And then the other key piece is because we're an open standards-based platform, you own your own data. You have access to it. Your other applications, other vendors have access to it, or you actually have access to that today. Currently, we're collecting right around 2 gigabytes of patient data per day at the bedside. That can range anywhere from a half a gig if they're on a very low number of devices to up to 3 gigs if they're on something like an EEG. Platform that we've been in the process and currently building with Google and Spring ML, we've been able to add additional capabilities to the system. We can move real-time data anytime and anywhere. If you guys come by and see our suite and able to see a demonstration, you're actually going to be able to see data that's coming out of one of our simulation testing for the NetSyn project. And we can actually get not only clinical data from that set of insights, we're also actually able to get medical device data. We can tell you how many devices are in use, what's being run, how is those systems working, and we can actually even show you what alarms are coming off of those systems as time goes on. We have the whole infrastructure that we've been building, all the way from the bedside all the way out to the cloud is built on a secure framework. We've modified and implemented a zero trust architecture. As this goes, as we move through this with multiple layers, we can have that discussion. Our system is actually very flexible and modular. So you can actually do a complete on-prem installation. You could be in your own private cloud, or you could be in a hybrid environment between the two. And then, you're going to be able to leverage this hospital-wide data for situational awareness, telemedicine operations, as well as other research, not only clinical research, but operational research. And once again, this entire Interoperability cloud framework has been built on open standards, so you can pick the best of breed solutions to be able to leverage these data flows and these data pipelines across your hospital. As I said, we have a private experience area where you can come actually visit our system for virtual demos, and actually get more information and insight. And if you want to have more information about NetSyn,
Do I this?
Great. So just to summarize what we do. So we're an IoT platform, integrate all the medical devices by the bedside. We also automate nursing documentation by 70%. Standard-based open platform allows third parties to integrate on our platform. But we also do activity tracking. We provide an ROI, which is extremely unique. And we can ventilator time, stop time, intubation, any activity that actually happens. So we quality control all the purposes with our investigators. That's what we do. The other aspect is, of course, analysis. And that's understood by everyone. We can go down to a single bed, we can be in one location, and we're able to provide a both campus and complex solution for the entire, and now cloud, Google, taking over care outside anywhere that individual needs to be. So, partnering with you, what's happening with NetSyn, National Emergency Telephone Care, which we're launching this year. Partners, live, right type, to meet if necessary. So,
Great. Can we see your platform?
absolutely. So there are two places here at your booth.
Yep.
3162, but at the same time, they can scan. We have a suite where they can see the live demo, and they can come to the suite and get the invite.
Great.
We're here all the way through till Friday.
Great.
Thank you.
Thank you so much, Bobby, for the talk. We are really excited to work with you on the Medicine project and as well as have a live running platform in our group, and we should stop by.
Thanks so much.
Thank you.
Appreciate it.